Hello, everyone, and welcome to this audio podcast. This audio podcast is part of the Pathogenesis edition. This audio podcast is part of the Torpedo storm and is part of the storm Richter. This audio podcast is part of a Storm Robotics production, and this audio podcast as part of this series, and looking into sort of service evaluation for young people suffering with uh, with long-standing illnesses and conditions, for example, chronic kidney disease or CKD. So this audio podcast will delve into the young people, looking at young people's challenges. So healthcare is now moving towards self-care and self-management routes. To ensure young people are included and receiving the right service, healthcare professionals or health professionals themselves need to ensure they know what patients require or need with regard to healthcare. And in addition, the proliferation of tech advances means that there is now an increasing need or requirement to ensure tech is available to better integrate healthcare services or specific healthcare services, and so to also allow swifter delivery of clinical care for recipients or patients with long-standing conditions or long-term illnesses, and at the same time, um, certain specific aspects in around healthcare have meant healthcare professionals have been also have a requirement to working a more working more to involve patients and the public in context of research to bridge gaps in around clinical care and clinical care and clinical services. At the same time, in in some aspects of this audio podcast series, there will be a little bit around around the terminology that's been thrown about quite a lot. That has been thrown about quite a bit or quite a lot in the literature. It's been referred to as patient and public involvement, or PPI. But before sort of before going before sort of delving into PPI, patient and public involvement aspects specifically, um, uh, in context, in line to and looking at sort of young people's services and where the challenges are. There has been works in forms of, for example, sort of other audios and podcasts and webinars, for example, and where researchers and investigators have highlighted and informed that patient and public involvement has been has been pivotal or important to ensure that in around specific or particular healthcare services, that that patients, recipients, and the public are involved to propagate a sort of an awareness where particular challenges are, and so investigators and researchers have involved in various sort of in various examples or published works where it's been documented that young people in around aligned to specific and particular healthcare concerns are involved, so that healthcare professionals, but also sort of the sort of the the multidisciplinary team more generally in context of healthcare are become sort of more informed of where not just where sort of the challenges are, but also where, for example, as per mentioned in part of the synopsis of this series, where where, for example, where there can be to highlight a sort of an awareness where there's differences or challenges in one region in context of young people's services versus another region in context of young people's services, and where patient and public involvement, patient and public, or PPI has and should allow the a basis for a sense of synchronicity of healthcare services between regions, so that disparities and inequalities are also sort of alleviated in context of healthcare services and healthcare provision. So that draws this audio podcast this audio podcast sort of a sort of an initial basis in around young people's challenges as part of this audio podcast, and this audio podcast as part of the Pathogenesis edition, and then part of the Torpedo, Storm, and the Storm Richter. This has been another Storm Robotics production.